Hey everybody, thanks for joining today. My name is Eric Speck, Peer Support Director at RPH Ally. Today we have a very special guest, Patty Mechael PhD. She is an expert in digital self-care, and we're going to talk about that today. I know when I first heard the term, I really had no idea what it meant. I honestly thought it was like reducing screen time and staying off of social media, but that is definitely not what she's going to talk about. So if you're interested in finding out more about digital self-care, stay tuned and we'll get to it right after this. All right, Patty, thank you for joining me today. How are you?
Great. Thanks for having me, Eric.
Absolutely. So yes, digital self-care was not a term that I was familiar with. Maybe I don't get out of my house as often as I should, or maybe it's just a very new thing. But you got to update me on the correct definition of digital self-care. So thank you very much for that. So why don't you tell our viewers what it is and why it's important? You know, I could probably do it too because you told me, but you're going to do a much better job. So I'll let you do it and save the viewers the pain.
Sure. So it's the use of digital tools to help individuals either prevent, pre-diagnose or diagnose and/or treat and manage a health condition, and it comes from a lot of the work that's being done by the World Health Organization on self-care, which is really trying to help move a lot of the burden of diagnosis, treatment, management from health systems and health professionals into the hands of individuals. And so and then using digital technology on top of that to facilitate those processes.
Yeah, so this is going to be decrease in healthcare cost, is what I'm hearing, and also decrease in patient outcomes because now instead of waiting weeks to go see a provider, they're able to provide the care to themselves at home, and it's going to cost much less than seeing a physician or another healthcare professional, most likely.
Absolutely. And we know that most people spend, very little time of theirs in their lives in the health system. So it really helps kind of empower people to take a more active role in
Yeah.
their own health.
Yeah, because before where they were powerless, now they actually have a power to do something about whatever medical condition they're suffering from or trying to prevent. You know, maybe they're at higher risk for something. When you could use a digital health device to prevent yourself from actually developing the disease, whereas before you didn't have as many choices, as many tools in your toolbox to be able to do that. And you mentioned pharmacists play a critical role in this. Tell us a little bit more about how pharmacists can do that. I mean, this is RPH Ally. Most of our viewers are pharmacy professionals, so I would love to hear your opinion on that.
Sure. I mean, because it does include a fair amount on, prevention, diagnosis, and then management, there's a lot of, digital self-care apps that are now and services that are now being offered, through pharmacies and that connect back into pharmacy services, including, the use of chat bots to help people kind of manage their care and treatment activities, and so they can be either a complement to an existing kind of health intervention, or they can be standalone health intervention. So we've seen for mental health and for standalone applications being used by individuals, but we've also seen for things like diabetes treatment, things that really require an interface with the health system, including, insulin, or trying to get, your treatment kind of sorted in a, continuous and supported way.
Yeah, and one thing nice about the pharmacist, everybody knows they're the most accessible healthcare provider, and so I think a lot of these digital products that are coming out to help people with self-care, they may not know exactly how to use it or what it does, but they're able to go to the pharmacy and say, "Hey, I'm using this product to manage my mental health. This is what it's telling me. These are my results. Is this a good thing? Is this a bad thing? How does this affect my medication?" Then you could have all those educational opportunities and be able to provide better care, as a pharmacist or any other healthcare provider based upon, a lot of the data that they're collecting, the things that they are doing as well.
Absolutely. Absolutely.
Yeah.
And a lot of like the devices that are in pharmacies, right? So people are going to pharmacies and they're getting things like, a digital blood pressure cuff so they can
Yep.
better track their own,
Yep.
blood pressure for, hypertension or for, so there's all
Yeah.
sorts of things that are happening that, and opportunities for, individuals to be kind of like equipped to become more active.
Yeah, definitely active in their care. And you mentioned AI, like everywhere you look, you're hearing about AI, and you said AI is important in this. And I believe what we were talking about is when they're training AI models or when they're developing these digital self-care products, they need to have a diverse data set when they're creating these. Otherwise, they're going to be biased and not give accurate results for everybody. Can you talk a little bit more about that?
Sure. So we're seeing a lot of use by the health system of things like, chat bots or virtual assistants, right? And
Yeah.
so, and those are giving guidance to people, but they're drawing on, research or data that is, helping to provide those protocols and that
Yeah.
and that guidance. And so it's really, really important when you're thinking about like designing some sort of like technology complement to, either a treatment or some sort of like health advice, et cetera, to make sure that whatever it is that you're designing it on is
Yep.
actually, representative of the populations that you're trying to serve. So if you're, we've seen, in the traditional health space, major challenges. An important example of this is, say, like heart disease, right? So a lot of the research done on heart disease has been done on, white men, and then the protocols for, detecting heart disease or preventing heart disease are
Hmm.
largely, applicable to white men. Then
Yeah.
you take that data and that information and you put it into, an AI model or a chat bot or something, then the
Yep.
recommendations that it's going to be giving
Yep.
to individuals is going to be biased because it's
Yep.
going to be, based on like a white male persona and research that's been done, predominantly on white men. And so, we're
Yeah.
starting to see some of this get rectified in the research space and trying to see, okay, we need more research that's representative of, you know,
Hmm.
every type of person,
Yep.
and that can then feed into, the development and the use of AI in a more effective way and
Yep.
a meaningful way for better health.
Yeah, because like you said, if the AI is biased, and let's say it's trying to make a diagnosis based on certain data that's collected from a certain individual, it may be looking at that data and saying, oh, well, for a older white man, it's not a disease, but maybe for this particular person, it is a disease.
Right.
And the same thing for treatment. Well, this is the treatment we recommend for this person. This is what works best. But this person is an outlier from what that
Right.
model was trained on, so now it's not going to be a good treatment for them. And let me ask you this: what are the barriers for getting a more diverse set of data to train these models and develop these products? You mentioned a few times it's older white men. I mean, there are certainly a lot of other people out there in the world who aren't older white men. So, what's the barrier to finding a diverse subset of population to gather this data from?
Sure. I mean, I think we have an interesting opportunity as more and more people are using technology to engage them, more effectively in research and in
Yeah.
participating in research, right? So,
Yep.
having almost this like this cycle where, people become their own sort of like research subjects, and we can
Yeah.
do, a much better job of, tracking individuals, seeing what outcomes happen, what things are going on,
Hmm.
and then feeding that into, research data,
Yep.
that can then have a much more, comprehensive and inclusive,
Yep.
approach. But you have to, I think people, one, have to be aware of the dangers of not doing this.
Yeah.
And two, you need leadership in, organizations, whether they're technology organizations or health organizations, to
Yep.
really prioritize that as part
Yep.
of, their adoption and use of technology.
Yeah, yeah. So do you think that's something that these leadership personnel, these companies aren't aware of how important it is for this? Is that something that's just not on their radar?
You
Or
know,
they just don't think it's important? Or where are we at on that spectrum?
I don't, it's hard to tell because we're not seeing, like, we've been sort of like raising these issues now for like years, including just on like the basic, internet, right? Which
Yeah.
already has its own language challenges, you know,
Yeah.
um, you know, diversity issues, et cetera, architecture
Mhm.
issues. And
Yeah.
it really hasn't changed. And so to me, I think it's trying to get one more, frankly, more women and more
Yeah.
people of color into leadership positions that actually like care about these things. And
Yeah.
then, and then working with our kind of like white male champions to to like actually see this, these things as like an issue. I mean, there was a really interesting post, made ages ago by somebody who was like, it just occurred to me that Siri and Alexa are women, and
Yeah.
like we boss them around,
Yeah, I saw
but
that.
you wouldn't have like a
Yeah.
digital voice assistant that was male.
Yep.
And, it's sort of like we've been talking about that now for like 5, 10 years.
Yep.
And maybe we've only been kind of like talking to ourselves about it, but like, come on, you know.
Yeah. Yeah, yeah, I saw that post too. I never thought about it before, but it totally made sense. I actually told my wife about it, and I told you I have two young kids, and they're talking to our Alexa device. They're used to giving orders to women, so is that how they're going to be when they get older? They're never going to treat a man like that, but they think this is what women are for. I have no idea, but I think that was kind of one of the questions proposed in that post, and it really gets you thinking. What kind of subconscious effects is this going to have
Right.
on the younger generation when you don't have a male equivalent?
Right.
Yeah, at least not that I'm aware of, but I'm not huge into that space. You think they would have an option to make it male or female? Um,
Yeah, and it does for like GPS, right? So
yeah,
for
I
your
was
like
gonna
Google
say.
Maps, you can
Yeah,
select if
yeah,
you want like, a British male voice or whatever,
yeah,
and so like those things, but it's
yeah,
not, it's not as like easily apparent in, whether
yeah,
it's Siri or Alexa or like any of these things, how you would change the voice. And so we are,
yeah,
in many ways, we are reinforcing, negative biases
yeah,
that will have an impact on, subconsciously how we interact with
yeah.
the world.
Yeah, and the thing, this is pretty simple to understand, and it's pretty simple to agree with. So, and we saw that the impact of this in the future could be significant. So why aren't changes being made? Do you think somebody in a leadership position would see that post or hear somebody say it and be able to snap their fingers and then make a change, give it two different options?
Yeah.
Um,
You would think
so it's
that, and then you're like,
you
we're,
would.
yeah.
All right. Patty, we're about time, so I want to start wrapping things up. I'm going to
Sure.
go probably what I should have asked at the very beginning, but Patty, give us a little bit more about your background and where we can find, what is your area of expertise? What are you doing now? And then where could somebody go to find more information about you if they want to learn more?
Sure. So, my background is in public health. I have spent much of the last 25 years mostly working in global health in low
Hmm.
and middle income countries, in Africa, Asia, and Latin America. And a lot of my work is in the digital health and artificial intelligence space. And so I run a nonprofit called Health Enabled, which I co founded. And then I also am a professor of public health at the Johns Hopkins Bloomberg School of Public Health. And then my side hustle is that I I write middle grade fiction with my son. And so during the pandemic, we wrote a middle grade fiction book called The Antidotes Pollution Solution about a group of kids that have to stop a plastic eating bacteria before it
Oh,
makes fish and kids sick. So it's a climate induced public health challenge, and they have to apply, epidemiology and STEM to, bring this thing under control. And so you can find me on my website, www.patriciamechel.com. And really thank you for having me, Eric. This has been great.
yeah, no, it's been fun. I'm glad we had you on. Obviously, you're doing amazing things across the whole globe and writing really cool children's books also that are going to provide a lot of value. I may have to pick that up so when my kids get a little bit older, I can have that one for them. So
Sure. That would
yeah,
be great.
yeah, Patty, thanks again for joining me today. To all our viewers, if you have any questions for me, you can find me at rphally.com. Go to the Peer Support channel. Patty gave you her website. If you have any questions for her, feel free to reach out. Patty, thanks again for joining us. It's been a pleasure, and I will talk to you later.
Sounds good. The pleasure's mine.
All right, bye-bye.